Hello everyone, this is Dr. Priyanka Roy, Deputy Chief Inspector of Factories, Medical and Certifying Surgeon, Department of Labor, Government of West Bengal. My leadership project was about knowledge, attitude and practices towards occupational diseases among women workers in tea plantation, Darjeeling. This project was also part of another project which was started by International Labour Organization on safety plus health for all plantation workers in South Asia. I had chosen tea garden workers because 60% workers are women in tea plantation, and there are different kind of disparities in terms of their roles, in terms of their payment and working conditions. Tea garden workers are working in different hazardous and toxic environment. They are facing excessive heat, cold, sunlight, rain, noise, vibration. Also, they are exposed to chemical hazards, which is related to their spraying out of this insecticide, fertilizer. They are also suffering from different biological hazard like snake bite, insect bite, fungus infection, leech bite, mosquito bite, all. There are also cuts, bruises, abrasion, fracture during their work. Another important issues is their health problem related to their posture, their repetitive work, because tea garden workers are working all the day, standing and cutting and plucking tea leaves. I wanted to assess the knowledge, attitude, and practice among tea garden workers. And what about their assessment or knowledge about their work related issues? Whether they know the signs and symptoms which is related to their work, whether they know where to go for their health related issue, for their other conditions which they are suffering from, and their practice, whether they are going to health care provider inside the plant or outside the plant. I took 50 workers who are women in between 60 to 20 to 60 years of age and at least working history of more than 2 years. Any level of education was taken, and the criteria was whether they can understand Bengali or Hindi, as those are important for communication. So I conducted one training program after assessing their knowledge of health related issues at their work. Before awareness generation training, 30% workers had minimal idea about work related hazard, whereas after training, 70% of workers had minimal idea about their hazards. Before training, 60% of workers seeking healthcare facility for acute illness or injury. But after that training, 75% of workers understand that healthcare facility can be availed for work-related any disease, maybe chronic or acute. Also, 88% workers know that occupational disease can be prevented through adapting very simple measures. For example, just use one PP during their work. Other factors were also there during, and it came up when the communication was made. HR crisis at health center when they need at the most, and need of periodical medical examination, which is the part of statutory compliance under Factories Act 1948. Non-availability of PP was one of the big concerns. Also, absenteeism and wage related issues were there. This project was in collaboration with different stakeholders from statutory body, from worker representative and management. And it was very crucial for me also, as I learned how to listen. Listening to the workers is very important. And if there is any conflict, that should be resolved through empathy. Now, my leadership journey, I could rediscover myself as a researcher beside my job as an administrator. And this whole project, it was very inclusive, where I worked with multi-sectoral body, and it gave me the idea how to work with uh, different kind of people. It was also very strategic, as I designed this program targeted for women workers through pre-intervention evaluation and post-intervention evaluation. And this journey was very much impactful as I could change their mindset and their outlook towards their health related issues, and now they know about their occupational disease and where to seek help. I sincerely express my gratitude for awarding me this prestigious fellowship. I also extend my heartfelt thanks to my mentors, colleagues, and everyone who has guided and supported me throughout this journey. Your encouragement and insights have been instrumental in shaping my work and my future. Thanks again.